Alrighty, so we do have a second option. Graciously, Steph is going to let us spray this twice. We're going to do a spray here. We're going to do another spray with an IV poke here. We have a second option for people who truly are terrified of needles but still would like to have some numbing stuff. We have this new stuff called ethyl chloride. The OR uses it more frequently than we do. There is a learning curve to this. As you can see, she's got a vein right here. You have to be about 5 to about 9 inches above it, and you're going to spray it. And you spray it here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, about 9 seconds, and it should turn white. It is ice cold. The issue with this, you can see she's got a little bit of white there. It gets ice cold. The issue is you have to insert your catheter within 10 seconds of using this, because to our knowledge, this only lasts about 10 seconds, and I can tell this is cooling off already. It's ice cold when we first use it. I may have needed to use a little bit more. It will usually turn your skin white. So let's see. And you want to use it below the vein there.
So you can spray it for up to 7 seconds or until the skin turns white.
Okay. So not much of the white. I can feel it. The thing is it will freeze your skin. It's almost like a freezing spray. I can feel it, although it's not very white. Let's try this up here. We just want to do a comparison, and Steph, like I said, has graciously agreed to let us do this. I have not personally used this stuff on a patient. They usually more so in the OR, but this is always available. Are you doing okay, Steph?
Yep.
Okay, so we're going to use this, spray it for how long?
7 seconds
7
until
seconds.
it turns white.
So we're going to spray right below this vein here. So how far here?
3 to 9 inches.
1, 2. So 3 to 9 inches above the skin. 5, 6, 7. Is your arm hitting?
Okay. How'd that feel, Steph?
It feels cold, maybe a little burny,
Okay.
but nothing,
Nothing painful.
not painful.
Okay, so we are going to insert this. So right here is where the coldness is. Like I said, this has within 10 seconds or so, we're going to come right in here. IV is in. How did we do there? Did that numb up the same as the lidocaine?
I feel like the lidocaine was better. I didn't feel, it was a tiny poke, but that might also
You could
be
feel
because you're really good.
more of the pinch.
A little more of a pinch.
Okay, but this is truly, but better than nothing at all.
Better than nothing, for
Okay.
sure.
Okay.
For
So,
sure.
and maybe we should use just a little bit more. I'm not, like I said, this one is kind of a learning curve. So, whoop, I'm telling you, we got a nice big vein there. Sorry, Steph.
That's okay.
So a little bit more noticeable with the spray, but you know, a lot of, like I said, some people have that true phobia of needles. That is a big fat vein there, Steph. Some people do have a true phobia of needles, so that stuff might be a nice alternative. Just make sure you spray it for about 7 to 9 seconds, about 3 to 9 inches. I got a little bit closer, hoping to get a little more numbing stuff there for her. So either option is okay.
And with the cold spray, if your patient's skin's still cold or they're complaining of that pinching sensation, you can, once you get your IV dressed up, covered, you can put a hot pack on it.
Okay.
That'll warm up the skin.
That's great advice there. So don't be afraid to use a warm pack after you're all said and done with that that spray. And we do not carry that on the floor. That is something you would have to get from pharmacy, because only pharmacy carries that, correct?
We would, yeah, once we implement this, we'd probably stock it on RCC and we'll keep it on pre-op.
Okay. So the spray is always an option. Either option looks like it worked out well for Steph. So it's still, either option still takes the bite out of that IV. I always tell people, it doesn't care. The littlest IV, a 22 up to an 18, they all have a bite to them. They're not, they're not all that comfortable. So every little bit that we can do to help take some of that bite out of these patients for their IV, the better.
Okay. Thank you, girls.
Thank you.
Thank you.